So first, thank you very much for taking the time to attend this meeting. So this way of introduction, my name's Tom DeLacy. I'm the benefits consultant for the City of Nashua and Nashua School District. I've been working with Nashua for about 8 or 9 years now. The goal today is really kind of a medical plan overview, really kind of focused in on the HSA. Talk about the financial part of the HSA and how it really is a financial tool that you can use throughout your lifetime. And then talk about how Smart Shopper integrates with the HSA and can provide you additional benefits outside or above and beyond the HSA plan itself. So to kind of get things going here, the big question is kind of what is an HSA? And the way I try to describe an HSA is it really is two pieces in one. It's a high deductible medical plan coupled with a health savings account. Those two components make up what we call the health savings account insurance plan. So basically that health savings account is a tax-free account that is in your name. You own it. And in the HSA account itself is triple tax-free. I kind of think of it as the holy grail of taxation. Any money that goes into the HSA goes in tax-free, it grows tax-free, and comes out tax-free for qualified medical expenses. So if you think of any other sort of savings vehicle, a 403B, a 401k, an IRA, a Roth IRA, they all have two components that are tax-free, right? You might be able to put money in tax-free and it grows tax-free. When you take it out, you pay taxes. Roth IRA, vice versa, you put it in after tax, grows tax-free, comes out tax-free. This is the only thing that's triple tax-free, so it's pretty unique. The idea of the HSA goes back to the sort of ownership mentality. We're going to give control and dollars back to the individual, and under the assumption that you will make smart choices. People generally make smart choices about a lot of the things that they buy. Healthcare, that choice has not really been in your hands in the past. And the idea with an HSA is to give that money to you and believe in the fact that you will spend it wisely. Obviously, because that money stays with you and is in your hands, it gives incentives for you to use value-based medical providers. And it allows you to roll over any money that you don't use. So there is no use it or lose it provision. Anything that remains in your HSA at the end of the year just rolls over to the next year and the next year and the next year. So that money that's in there, we know that you'll use it wisely. So the big question that we get generally with the HSA is, okay, if I'm on the HMO now, how is this different? What's covered, what's not covered, what's the network, and so on. The HSA covers exactly the same things that the HMO covers. It just covers them a little bit differently, how you pay for it. But the actual service is covered just like it is in the HMO. It's in the HMO, you pay a copay. In the HSA, you pay towards your deductible. The network in the HMO and the HSA is the same in New England. 100% the same doctors, the same hospitals. Everything in the network is the same. However, there is a new tweak that will be effective July 1st of 2021. Anthem, you may or may not know, went through a system enhancement to their claim paying system last year. That's allowed them to take their national network and layer that onto the regional network for the HSA product. What that means to you is you have access to any Anthem Blue Cross provider anywhere in the country in the HSA plan. Up until June 30th or July 1st of this year, it's always been that you had access in New England, New Hampshire, Maine, Massachusetts, Vermont, Connecticut, Rhode Island. Starting July 1st of 2021, if you're in the HSA plan, you'll be able to use providers anywhere in the country. So if you have that college student that needs regular services, or you have a split family, not all living in New Hampshire, or you just have a young adult, 23, 24, off on their own, but still on your plan that maybe lives in, pick on Colorado, they can access any Blue Cross provider in that state where they are, okay? If you're in the HMO, things remain the same. You have the New England Regional Network, But if you have a dependent who's outside of the New England Regional Network, they could use the away from home plan. They have to sign up for that. Unlike in the HSA moving forward, you just use the providers that you want. In the HSA, just like the HMO, preventive care is covered at 100%, no difference in any of the plans. And that was really part of the ACA back in 2012 that mandated that preventive care be covered at 100%. So there's no barriers to that basic care that everyone should have on an annual basis. Interestingly, if you go back to the early 2000s, HSAs pretty much always covered preventive care at 100% because they saw the value in that. The HSA, the account itself, can be funded by you, your employer, or a third party. In the HSA, you pay an annual deductible, and then once that deductible is met, the plan pays 100% for the remainder of the year. And we'll get into some more detail on that. So what's covered in full? I mentioned preventive care, so that's things like routine physicals, screenings, mammography screenings, pap smears, colonoscopies, immunization, contraceptives, routine vision exam. All of those preventive services are covered at 100%, not subject to the deductible. So what is subject to the deductible and how does the deductible work? The easiest way, I think, to describe a deductible is to think about your auto insurance. Everybody's pretty familiar with auto insurance. You always have a deductible on your plan, and if your deductible is, say, $500, and you get into a fender bender and it's $2,000 to fix your car, the insurance company is going to say, well, the deductible is $500. You pay that $500. Then the insurance plan will pay the remainder. So if the bills to fix your car is $2,000, you'll pay $500. The plan will pay $1,500. That's the basic concept of the deductible. You pay the deductible before the plan pays anything. If you think about your auto insurance again, and you take your deductible of $500, and at your renewal, you raise that to $1,000, what happens to the premium? I increase the deductible, premium goes down because I'm taking more risk. So if my deductible goes from, say, $500 to $1,000, now I'm responsible for the first $1,000 of the repair. So it makes sense that the premium goes down. The same thing applies in healthcare. So with the HSA plan, we took the deductible and took it from $250 all the way up to $2,000 for an individual or $4,000 for a family. By doing that, the premium rate went down. We take that difference, and that's what we use to fund the health savings account. So your plan deductible is $2,000 for an individual, $4,000 for two-person or family. Everything other than preventive care goes towards that deductible. So it's subject to deductible. So doctor's office visits, specialists, prescriptions, lab, x-rays, inpatient, physical therapy, all of those things are subject to the deductible, which means if I go for a doctor's office visit that's non-preventive and the bill is $150 after the Anthem discount, I would need to pay the $150 because I haven't met my deductible yet. If by chance I had met my deductible, the $150 would be covered 100% by Anthem because I've already met my deductible. So when we start talking about a $2,000 deductible or $4,000 for a family, that usually scares people. And if we're in a live meeting, I would see a lot of faces going, oh my gosh, that's a lot of money. And it absolutely is. But remember is that deductible goes up, the premium goes down. And that savings we use to fund the health savings account. So the city of Nashua will give you annually $1,500 for a single in the HSA plan or $3,000 for a two-person or family plan. So when you kind of run the math out here, your deductible is $2,000 for a single or $4,000 for a two-person or family plan. The HSA contribution is $1,500 for a single or $3,000 for a two-person or family plan. So your kind of worst case scenario or deductible exposure after the contribution by the Nashua School District is just $500 for a single or $1,000 for a two-person or family plan. Again, after you meet your deductible, you paid that $2,000, you use your HSA money to help pay the $2,000. you pay zero for any qualified expenses. And the reason that we always put something like qualified expenses is it's got to be covered by the plan, the same as any other benefit. Contributions to the HSA, effective, assuming you move forward with your negotiations, effective July 1st, they would be 50% of the contribution is paid to you in July, the other 50% in October. And one of the reasons that we don't do it all at once is because once that money goes into the HSA account is in your name. No one can pull money back out of it. The insurance company can't go in and take money out of it. The only way money comes out of your HSA account is if you direct it, either through an online payment, a check, or a debit card purchase. So 50% goes in July, the other 50% goes in October. If you were to leave the city of Nashua or the Nashua School District, anytime you leave, whatever money is in there is yours. You take it with you. It's completely portable. So if I've been with the school district for 3 years on a family plan, I've never used any of the HSA money, and there's $9,000 in there. If I leave and go to another employer, that $9,000 goes with me. That HSA account is always yours. Now, relative to the contributions, there could always be a hardship that in July, someone has a hospitalization, and that hospitalization is $10,000. Well, you're certainly going to blow right through your deductible of, let's say it's a family plan of $4,000. So you're going to owe $4,000, yet only have $1,500 in your HSA account because it's still July. If you bring that receipt into human resources or send it to them, scan it and send it in, they will accelerate the contribution to the HSA so that if you needed all of that money in July or August or September, they could get that into your account as long as you have receipts to show that you've actually spent that much. Up to the cap of $1,500 for a single or $3,000 for a family. So when we look at the rates for the HSA relative to the HMO, one of the great things about the HSA is I think it's actually the best value that you have. And I would say right now, I am a true believer in HSAs. I've had one for about 10 years now. Most of my clients offer HSAs, and some of them, the only thing they offer is an HSA. And they've seen very good results from doing so. The HSA, even though in my opinion, it's a better plan than the HMO, the premium is a little bit less currently. So the 2020 and 2021 premiums are actually going to stay the same. So some good news for this year is that there will be no increase to the insurance rates for the plan year that starts July 2021. So the rates that we have currently will remain. Right now, if you're in the HSA plan, as a single individual, your annual contribution out of your paycheck is about $2,032. If you're on the HMO, the annual contribution out of your paycheck is $2,419. So that's a savings to be in the HSA of about $387. Two-person, you can see the savings of $791. Family, the savings is $1,262. So anyone on the HSA right now on a family plan, they're saving $1,200 out of their paycheck. If we think back to our last slide, what's their risk? They have a $4,000 deductible. Nashua gives them $3,000, and they're saving $1,200 out of their paycheck. Kind of the biggest no-brainer in healthcare right there for the HSA for a family. For a two-person, you'd save $791 out of your paycheck. And what we would recommend in all of these scenarios is take that money that you're already spending on the HMO, payroll deduct it into your HSA. The money goes in tax-free, grows tax-free, and comes out tax-free for qualified medical expenses. If you don't use it, it just rolls over to the next year and the next year. So for those people that went into the HSA last year, their overall risk in a single plan would be, they get $1,500 from the school district, plus they save $387 out of their paycheck. So their worst case scenario is spending about $113 out of their pocket over the course of a year. And then you see it for the 2-person and family plans. So there are a lot of different things that go into why do you make the decision for HMO versus HSA and so on. Now, as part of negotiations, there's a proposal that the HMO would change from a $250 deductible if you were hospitalized or had an outpatient surgery, to a $1,500 deductible. So remember we talked about before, we raise the deductible, premium goes down. And you see that here in the, what I'm calling the new HMO that has that $1,500 deductible if you're hospitalized or have an outpatient surgery. You see that that premium dropped pretty significantly from $2,400 out of your paycheck for a single all the way down to $1,900. So by increasing that deductible, you lowered that fixed expense that you spend every paycheck for your health insurance. However, you did take on that liability of a $1,500 bill if I'm hospitalized or have an outpatient surgery. So with this change, the HMO actually becomes less expensive than the HSA. Now, in the HMO, if you have a $1,500 hospitalization, well, you know you have $1,500 in your HSA. In the HMO, you don't have that $1,500. You have to come up with it yourself. So a little bit more math here, right, to try to figure out what's the best solution for me and for my family. Am I better to be in the HMO and have the exposure to that $1,500 deductible per person in the HMO, or am I better off to be in the HSA and know that I have that $1,000 exposure once I get the contribution from my employer? So let's look at a couple examples of how the HSA would work in practice. So we have this individual, Carol Lewis. She's on a single HSA plan. If you look to the right, Preventive Care, covered at 100% in that blue box. Down below that, you see the HSA contribution. Now, her employer, the city of Nashua, gives her $1,500. She's decided that she's going to pre-fund her HSA and put $2,000 of her own money in there because she wants that money to go in pre-tax, grow tax-free, and come out tax-free. She's also probably thinking about down the road. And one of the things, the flexibility of the HSA is, if I have an 8 or 9-year-old child and I see that their teeth are already going in different directions and they're probably going to need orthodontia, I can start putting extra money into my HSA so that 3, 4, 5 years from now, when I know I'm going to have to drop $6,000 on braces, I've got that extra $6,000 in my HSA that I put in pre-tax. So I didn't pay income tax and I didn't pay Social Security and payroll taxes on that. That money is in my HSA and available for me to use for braces for my child. So Carol put $2,000 of her own money, so she's got $3,500 in the HSA. Her annual deductible is $2,000. After that, in-network coverage is covered at 100%. Over the course of the year, she has her Well Woman preventive exam. The cost of that is $350, but she doesn't pay any of that because it's preventive and covered at 100%. She also has some prescription drugs. The cost of those is $300. So her total expenses for the year are about $650. That would be a pretty average expense for about 20 to 30% of our population year in, year out that spend less than $1,000. So when she looks at her particular situation, she knows I don't have to pay the $350 for the preventive exam. She's got to pay the $300 for her prescriptions. So she uses her HSA debit card, pays that $300, and rolls over a balance of $3,200 to the next year. Next July, she gets half of her contribution in July. She gets the other half of her contribution of the total $1,500 in October. So if she didn't have additional expenses, by the following October, she'd have $4,700 in her HSA, but her deductible is still only $2,000. So let's look at another example, the Wilson family. So again, preventive care is covered at 100%. The HSA, they've got $3,000 from their employer, and they've decided not to put any money into the HSA out of their paycheck. Totally up to them. Their annual deductible as a family is $4,000. And after they've met their deductible, if they're in network, everything is covered at 100%. So they have preventive exams of $1,400 in total. Again, no cost to them. Prescription drugs of $900. And then they have a hospitalization and surgery of $14,300. So that's obviously going to blow right through the deductible. It's more than the $4,000. And after that surgery, there's some physical therapy that costs $600. So their non-preventive expenses are $15,800, far greater than the $4,000 deductible. They paid part of that $4,000 deductible with their HSA. So they're left owing $1,000 to, let's assume it's a hospital here. Now they can write a check to the hospital, use a credit card, but the best way for them to pay this bill is to actually get that $1,000 into their health savings account and then pay the bill from the health savings account to the provider. The reason that they want to do that is any money I put into the HSA goes in tax-free, grows tax-free, and comes out tax-free for qualified medical expenses. And this is the flexibility of the HSA versus, say, the flexible spending account, the FSA. With the HSA, you can put money in anytime you want. You can write a check and put money in, or better yet, you can go to HR or payroll and say, hey, I need to get $1,000 into my HSA. I want to put $250 per paycheck for the next 4 paychecks to get that $1,000 in. And then I can use that pre-tax $1,000 to pay the bill and save $200 or $300 on taxes. So it's completely flexible. And that's why I say it really is a financial tool that you can use to avoid taxes and meet your obligations. So who's eligible to open an HSA? Because of the triple tax advantage of the HSA, the IRS and Department of Treasury get involved, and they, of course, have to put some rules on it. So to have an HSA and contribute to that health savings account, you must be enrolled in a high deductible health plan. And it's got to be a qualified high deductible health plan. Ours is. It has to have at least a minimum of $1,350 deductible and some other features. You can't be covered on another person's health plan and still make contributions to your HSA. So for example, I can't have a high deductible health plan and I can't open an HSA and make contributions to that if I'm covered under my wife's HMO. Okay. You have to be a US resident, not a resident of Puerto Rico or American Samoa. You can't be enrolled in Medicare because that would be considered other coverage. You can't be claimed as a dependent on another individual's tax return. And you can't be active military, again, because that comes along with healthcare coverage. Now, for those who might be approaching age 65 and Medicare eligibility, and you're saying, hey, I'm going to keep working until I'm 67, 68, maybe further. You can actually go to Social Security and ask them to defer your Medicare eligibility. And if you're not aware, Medicare A is automatic, it just happens. Medicare B and D you have to pay for. But you can go to Social Security and say, hey, I want to defer my Medicare Part A and I don't want to elect B or D until I'm fully retired. And that if you do that, you can still contribute to a health savings account. So how do you get the most out of your plan? Whenever we do a presentation, I always like to throw in some of these tips of how you can get the most value out of your healthcare plan. One of the ways is use the Anthem website to search for cost savers. You can utilize Anthem's Live Health Online. That's the telemedicine program that Anthem has, where you have basically like a Skype or a FaceTime visit with a provider, and it's to handle minor types of things. You're obviously not going to deal with a broken bone or a laceration that way, but if it's a cold, strep throat, things like that, typically those can be handled via an online visit. and the provider can write a prescription and electronically send it to the pharmacy so that you can go and pick it up. You can shop around for the best prices and discounts on prescriptions. GoodRx is an app that we really like. Choose generics versus brand name prescriptions. Take advantage of pharmacy prescription cards. One note about GoodRx or pharmacy prescription cards: if you're using their pharmacy prescription programs, those are usually happening outside of the health plan. So they're just ignoring the health plan, almost like you didn't have insurance at all, and they're just giving you a direct discount. If you used one of those pharmacy cards or discount programs, that would not count towards your deductible because you're not running it through the Anthem system. They would have no way of tracking that. But we've certainly seen I've seen it in my own healthcare, but I've also seen it with members from different municipalities where it's still been beneficial for them to use that pharmacy card and go outside of their insurance. They just got a much better value. And then Smart Shopper, we'll talk a little bit more about that. So how are HSA claims paid versus, say, an HMO claim? And this is really going to be sort of the biggest difference in the HSA plan for the versus the HMO. You're going to have to do a little bit more work in the HSA than the HMO. In the HMO, you're used to, you go to the pharmacy, you show them your ID card, whatever your copay is, the pharmacist charges you there, and you use a credit card or an FSA card or whatever means you have to pay that bill. In the HSA, it's going to work very much the same in the pharmacy. There's really no difference. You go to the pharmacy, show them your Anthem card. They are going to go into the system and they can see directly into Anthem's system whether you've met your deductible or not. If you've met your deductible, they're not going to charge you anything for the prescription. You're going to go on your way. If you haven't met your deductible, they're going to charge you the actual discounted rate for that prescription. So for instance, a prescription drug that might retail for $150 probably has, after discount, a cost of $120 if it's a brand name. If it's a generic, it might be as low as $10 or $15. The provider is going to put that into the system and they're going to charge you whatever that discounted rate is. Let's say it's $120. You have your HSA debit card, you swipe your card, the $120 comes out of your HSA account. It also reduces your deductible by that $120. Pretty simple, pretty much the same as things work in the HMO. At a doctor's office or hospital or facility, it's a little bit different. You're going to go to the doctor's office. They're not going to charge you anything at the front desk because they don't know what to charge you. You don't have a copay. You're going to go through your visit. They're not going to charge you anything on the way out. But typically about a week later, you're going to receive something from Anthem that says, and this is an explanation of benefits. It says, Tom, you saw Dr. Smith on this date. The charge was $250. Our allowed amount after our negotiated discount with them was $150. You've met your deductible, you're good to go, no charge. Or you haven't met your deductible, you're going to owe the $150, expect a bill from the doctor. The doctor gets the same type of explanation of benefits that says, you know, you billed this, $250, $150 is allowed, the member's met his deductible, here's your check. Or the member hasn't met his deductible, bill them the $120. You get that bill from the doctor for the $120, you match it up to the explanation of benefits, and typically you can pay those bills online, or you can just take your debit card, write your debit card information in the space, typically on the bottom or on the back of the bill, and you can pay with your debit card right there. So a little bit more involved than, you know, $20 or $30 at the doctor's office, but really pretty simple. All of this is online with the HSA vendor, so you can see what your balance is. You can pay bills online. You can see what your deductible is. So we really try to make it very simple for people. So moving on a little bit, I love this slide from Smart Shopper because I think it really sums things up. There is tremendous difference in price for medical services with no discernible difference in quality. So an MRI in one facility might be literally $2,800. Same MRI, same machine, different facility, $800 or $900. And that goes for lab services, outpatient surgeries, colonoscopies. You name it, there is this huge variation in cost. And this slide is really making the point of where you go, what facility you go to, has a huge implication of what it's going to cost you. So that's where really Smart Shopper was born about 10 or 11 years ago. And it was actually right in New Hampshire. We were sitting with Anthem and the mayor in New Hampshire, mayor in Manchester at the time, and started talking about this difference in the cost of services. And what we looked at was, why we're looking at this, I have no idea, but a colonoscopy within 10 miles of City Hall in Manchester ranged from $4,600 to $1,600 with the same doctor. Just depended which facility you went to have that colonoscopy done. So that got this whole thing started where we said, boy, wouldn't it be great if we could come up with a solution where people could just pick up the phone and say, hey, I have to have an MRI or a colonoscopy or a lab service or whatever it may be, and they could direct you to the low-cost provider. Now remember, all these providers are still in the Anthem network. They're vetted every 2 years. They have to go through the same credentialing process. So it's not like we're saying, hey, this provider over here that's really not very good. They're all in the network. They're all credentialed, and they have to meet certain standards to be in the network. So the way that Smart Shopper works, many of you, I think, have used it. Some have not. But basically, a doctor recommends a medical service. You can either shop online, or you can call the 800 number for the patient advocate, and they'll walk you through the process. They direct you to the low-cost facility. It's completely your option whether you go to the low-cost facility or not. You may say, I really want to go to, I'm going to pick on Dartmouth-Hitchcock. I really want to go to Dartmouth-Hitchcock for this MRI, and I don't really care that it's not the low or lower cost, more efficient provider. Totally up to you. But if you do go to that more efficient provider, you earn an incentive, and that incentive shows up in your mailbox about 4 to 6 weeks after your service. Each time you use Smart Shopper, you have to call or shop online, because that's how we know if you just stumbled into the low-cost provider or were directed to the low-cost provider and earned that incentive. Everything has kind of gone, computer these days, but we thought it was really important that Smart Shopper still give you the ability to just pick up the phone and call someone and talk through it. So the personal assistant team is available 8 to 8 Monday through Thursday and 8 to 6 on Friday. When you go, they'll direct you to the low-cost provider. When you call them, they'll direct you to the low-cost provider. But they'll also do a 3-way call with you if you like, and change your appointment from maybe a more high-cost provider to that low-cost provider. One and done, you get it all done and out of the way. Here are just a few samples of the cash incentives that you can earn. And obviously, the more expensive a procedure is, the more that you can earn by going to the low-cost provider. So colonoscopy, CAT scans, knee arthroscopy, ultrasound, physical therapy, MRI, and so on. There are about 60 different procedures that you can earn an incentive for. Now, you'll probably notice that we have up to, so look at the colonoscopy, up to $250. What we found over time was we started with, well, what's the low-cost provider? Who's the most efficient? And let's say it's Dairy Imaging or Bedford Nashua Ambulatory Surgical Center. What we found was that someone in Manchester might not want to drive to Nashua, or someone in Nashua might not want to drive to Manchester. So what we found is that people were willing to go, maybe they would go to Derry, or maybe they would go 5 miles out of their way, but not 10 miles out of their way. So if we could find a mid-level provider, so you might find a colonoscopy where they say it's $250 to go to the low-cost provider, but there is a mid-range provider, and if you go to them, it's closer to your home or to your office, it would be $150. So there could be, with certain incentives, there could be different tiers of that incentive based on the cost. So quick example of how Smart Shopper works. So a person has a knee injury, they go to their doctor says, boy, that's looks bad, I want you to have an MRI. You call Smart Shopper. Smart Shopper, based on your address, says, hey, the low-cost provider is 10 miles away. You say, great, I'll go to the low-cost provider. You earn a $150 incentive from that. Based on the results of the MRI, the doctor says we're going to need to do a knee arthroscopy. You call Smart Shopper, they direct you to the low-cost provider, and really the provider in this case is the facilities. Most surgeons have access to multiple hospitals, multiple outpatient surgical centers, so they have the flexibility to go to different locations. Again, you don't have to go, but that option is there. If you do go to the low-cost provider, there's a $250 incentive. After that surgery, you clearly need physical therapy. Again, you shop with Smart Shopper either online or by phone and go to the low-cost facility. You earn a $150 incentive. So based on this, unfortunate incident, this individual earned about $550 that got paid in 3 different checks. You can then take that money, put it into your HSA by doing it through payroll deduction or writing a check into your HSA, and that money becomes tax-free to you. Because the IRS, again, is involved and there are the triple tax advantage of the HSA, there are some limits on how much can be contributed to the HSA each year. There are no limits on how much you can accumulate over a lifetime, but there are limits to how much you can put in each year. So if you're on a single plan in 2021, the amount is $3,600, family coverage $7,200. If you're 55 or older, the person who actually owns the HSA account is 55 or older, that individual can put an additional $1,000 into the HSA account. And we have the 2020 numbers there, so you can see it goes up a little bit each year. It seems to, over the last number of years, the single's gone up by about $50 each year. Family's gone up by about $100. So the idea is to keep pace with inflation. Expenses that can be covered under the HSA, these are really the same expenses that you can use FSA dollars for. So it's things like, your offices, labs, prescriptions, any of your covered health benefits. But there are also things that are outside of your medical plan. Dental care, braces, eye exams, glasses, contacts. You can use HSA dollars for all of those things. Be careful though, because sometimes people will run into a problem where they'll say, hey, I've got $4,000 in my HSA. I'm going to take $2,000 out to pay for dental services. And then they forget that now they only have $2,000 left, but they still have a $4,000 medical deductible because those dental services don't reduce my medical deductible. So if you're going to use money for dental or eye glasses or things like that, make sure you're putting a little extra money into your HSA. So you can still cover your deductible. And it really is much like you would put money into your flexible spending account. Not covered, things like cosmetic surgery, over-the-counter medications without a doctor's note, teeth whitening, all the same things that you're used to that aren't covered by medical plans. So last slide here, just looking at the growth of an HSA and over the years where we've offered HSAs, we have people with, $30, $40, $50, $80,000 in their HSA that they've accumulated over a number of years between employer contributions, their own contributions. And then once you have at least $1,000 in your account, you can actually invest in mutual funds. Really a personal choice, whether you want to be very safe with that money, because at the end of the day, it's meant to cover your healthcare costs. Or if you want to use that money, be more aggressive and put that money into mutual funds and take some risk with it. When you retire, when you reach age 65, that money can be used for anything that you want. However, if it's not used for medical expenses, you would pay normal income taxes after the age of 65. So it kind of follows most retirement rules, with a 401k, 403b, that if you use that after age 65, there's no penalty, but you would pay ordinary income taxes. So if you at 68 use it for medical expenses, no taxes. 68, you use it to buy flat screen TV, then you just pay ordinary income tax. You add that money to your income taxes for the year. Again, fully portable, goes with you, and is there really to help you take better control of your healthcare spending and accumulate some money for your retirement. So with that, that's all we had for prepared slides. Happy to take any questions that you have. And if people don't have questions right off the bat, Kim, maybe you can read any of the emails or things that you received.
Right. I'll share your screen.
Questions, anyone?
What was that?
No questions?
Yes, I couldn't unmute.
Okay.
So I did put a question in the comments about can contributions be made after retirement, because you talked about payroll deduction. It sounds like that is the case, but.
So you said after retirement. No, are you talking about, so contributions can be made as long as you are actively enrolled in a qualified high deductible medical plan.
Okay.
So if you're, for instance, an early retiree, if you have the qualified high deductible medical plan, you can absolutely make contributions.
Okay, great.
Any other questions?
Yes, I put a question in the chat. When I looked on the invitation to come today, I thought it was a health insurance overview, but it was really interesting about the HSA. But will we get opportunity to have a live health insurance overview?
Yeah, we are going to have open enrollment meetings, and I think the notices were going out this week. So we do have a couple of live open enrollment meetings where we'll walk through more detail of the HMO, how to enroll, all the parts of the full benefit package, dental as well.
So that's not April 21st and that's not May 4th.
Correct.
Okay. Got it. Thank you.
Tom, it's Carol. Can I add into that?
Sure, please.
So Stacy Hines was posting the other open enrollment sessions for people to sign up on the, I'm not sure if it's a teacher's board or something that she posts on, but I did talk with her today to be sure, because she was trying to understand what's the difference of the 3 sessions that just got scheduled versus the 2 sessions in the first week of May, which is May 3rd and May 4th. The 2 that I sent out are for open enrollment, and it will have all of our plans discussed in that one.
Yeah, I apologize. So Jennifer, so and just because I couldn't look at my screen, so it looks like we have an open enrollment webinar on the 3rd at 4 o'clock, and then on the 4th at 10 a.m.
Okay, so that information will probably come to us in an email from Stacy at some point.
I'm not sure if she's sending an email. I think she mentioned that she posts things on a board that you all know to go look at.
It was in the iNews, e-news, whatever comes out on Friday. I forget which one is which, but last Friday, Jennifer, we got an email from Stacy with those 2 dates.
You did. You're right. I thought these were the same. That's what I thought this one was. But this was not health insurance overview. Right. But that's what's posted on our note. Good morning. That's how I got the link from a health insurance overview, but this wasn't. But I will find the health insurance overview and come to that one.
There you go.
Okay, thank you. I'm sorry about that.
No, that's all right. I didn't know.
Up.
Yeah, so we needed to know. All right, thank you. Appreciate it.
You're welcome. Any other questions or anything that was on the chat that maybe we didn't here so far? Or if you put a chat in, and feel free to just unmute yourself and ask a question.
Thank you. I'm going to sign off, but I appreciate the information very much.
You're welcome. Thank you. All right. Since no other questions, I guess nothing in the chat. Well, thank you very much for your time and attention, and hopefully you'll see those notices of the other meetings and encourage others to jump onto one of these if they have an opportunity.